Hi, good morning Henner. My name is Bronwyn Viata. I'm your invigilator for the OET speaking session conducting on the 12th of February 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Henry Joel.
And what is your candidate number, please?
My candidate number is 151372108.
Thank you. And you are taking this test as a doctor. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Yes, sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What do you see as the future of healthcare?
With a wider variety of providers and care teams operating at the top of their licenses, I think it will be vital to pay attention to every perspective. Collaborative and connectivity apps will help providers build a cohesive team in patient care.
Talk about a time when you disagreed with a coworker.
A new specialist, who was brought onto our care team, disagreed with the approach we were taking with the cancer patient, wanting to pursue a more aggressive treatment. However, the family and patient had already made it clear that they were ready to look at palliative options. I made a commitment to talk with the specialist briefly when we were both free. We met and I went over some information about ensuring the patient and family have a voice in the care team, and the specialist appreciated the reminder. We ended up pursuing the original plan I'd laid out.
What's your biggest career mistake or failure?
I learned the hard way about how to manage night shifts about 5 years ago. I was so used to managing day shifts that I realized there was a whole culture of the night shift that I was unfamiliar with. On top of that, the hours were killing me. But I paid attention to my more seasoned colleagues and did some real soul searching about how I could better handle managing the job. My first 6 months were tough, but after I made a few key adjustments, I grew to really like that job at that time.
How would you deal with a rude doctor?
I have been very lucky in that I have had the good fortune to work with doctors who were always professional in their interactions with me. If I were to work with a doctor who treats me badly, I would bring the matter to our superior or management right away. That's because, if any doctor was displeased with me in some way, I would want to find out so that I could take action to rectify the situation.
Where do you see yourself in 5 years?
In 5 years, I'd like to have a stable career, hopefully with a very good organization. I'd also like to get more involved in the community. I'd like to make a positive difference both in the organization and in the local community.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start the role play. Don't worry if I stop you when the time is up.
Hi, good morning. I'm Dr. Henry Joel, one of the doctors in this clinic. May I know your full name for the record, please?
Hi. Good morning, doctor. My full name is Bronwyn Viata.
Nice to meet you, Bronwyn. May I know what brings you here today?
Doctor, I have a family history of early onset Alzheimer's disease. My father and my elder sister both have the condition. I have come here to discuss the possibility of genetic testing for inheritable forms of Alzheimer's.
I see. Bronwyn, have you ever noticed or experienced conditions like losing yourself at any point? I mean forgetting what you are about to do? Feeling difficulty in remembering things, or difficult to remember where you have kept your daily utilities? Anything like that?
Yes, doctor. I have felt a few times, and that made me more suspicious about the condition.
Why I inquired about dementia generally is to know that you are familiar with the symptoms of Alzheimer's or not.
Yes, doctor, I am familiar with the symptoms. And that's the reason why I like to do genetic testing, because of my family history.
I understand the cause of your consciousness about it. Nevertheless, there are other possibilities as well. I'm summarizing that you may be experiencing other forms of impaired cognitive performance, such as depression.
Oh no. Doctor, how come you point out that? I'm really surprised to hear such a thing from your side.
I know you will be so surprised to hear that. Let me explain it to you. There is the possibility of having impaired cognitive performance, such as depression, in your case.
Oh, I see.
Due to the fact that you are aware of Alzheimer's in your family history, and right now, you are preoccupied by the thoughts, and unconsciously, it may cause depression in you.
Oh, okay.
Hence, I suggest you consult a clinical neuropsychologist before considering having genetic testing.
Doctor, are you sure that I should consult a neuropsychologist before considering the genetic testing?
I will explain it to you, Bronwyn. As I mentioned earlier about the chance of impaired cognitive, like depression, a neuropsychologist can perform the formal cognitive evaluation, and an assessment of the possibility of depression can be done. Consulting a neuropsychologist and performing the evaluation is the easiest way than performing genetic testing. I hope you understand the importance right now.
Well, my mind suggests genetic testing. However, I consider your opinion, doctor. I will consult a neuropsychologist first.
That's great, Bronwyn. I really appreciate your effort to consider my opinion.
Thank you, doctor.
Also, I would like to recommend one more counseling before undergoing genetic testing. It is genetic counseling.
A genetic counseling. But why?
Yes, prior to any future genetic testing, you should perform specialist genetic counseling. It is the counseling from health professionals with specialist training in genetics and counseling. This counseling is done to find out the possible outcomes of the testing. Am I clear to you, Bronwyn?
What you suggest is that, if genetic testing is deemed necessary, I should undergo genetic counseling before that. Isn't it, doctor?
Yes, Bronwyn, you are right. That's what I recommend.
All right, doctor. I agree with your recommendation.
I am very glad to see your accepting mentality. I wish you a hassle-free, healthy life ahead.
Thank you for your guidance, doctor.
Bronwyn, do not hesitate to contact me for further discussion and procedures.
Sure, thank you, doctor.
No mention, please.
That is the end of your OIT speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.